The road to Brazil begins here.
Okay, yes.
Hi, my name is Dr. Mike Patterson and I'm the Chief Medical Officer here at Wembley Stadium in London. Wembley Stadium is the national stadium for England and primarily was set up to host events from the England football team and the major football events here in the UK. More recently we've been tasked with looking after the care of spectators for other major sports events such as the NFL in London and the Rugby World Cup, and also major concerts. We have anywhere between 70 to 110,000 people visiting the stadium in any one event, and part of the job that I do as the clinical lead here at the stadium is to provide and oversee the clinical care that takes place for these people. We have anywhere between 70 to 100 people working within the medical service at any event. Of course, as you can imagine, with such a large amount of people coming from all over the country, this is like providing medical care in an emergency setting, a pre-hospital care setting for a small village. We have people working under us who are not healthcare providers in what they do, and they act as first aiders, and we provide all the training and facilities that they need to learn as first aiders and healthcare assistants here within our clinical governance system at the stadium. We have paramedics and nurses of all ranges of seniority, and they also plug into very specific and multidisciplinary training initiatives that we take place here at the stadium. And then we have doctors working here as well as clinical leaders. Most of those doctors have extensive background in emergency medicine and pre-hospital care, both from emergency departments, pre-hospital care teams, and from critical care backgrounds. As myself, I work as a consultant in emergency medicine and in intensive care medicine, where I share event management within the UK and indeed in Europe. We are the only sports stadium in the UK and one of the few ones worldwide where the care that we provide for people coming with tickets to the event and the elite sportsmen that play here is completely integrated. Within our medical facility, we have 8 minor medical beds where we can see all range of the emergency medicine presentations that can come to us, and we have 2 fully stocked resus bays that can provide early resuscitation and assessment of patients before they're transferred on to secondary or tertiary care within the healthcare organisation and structure of the NHS within London. Within our resus room, we can be just as likely to be looking after somebody in cardiac arrest with a coronary artery disease who needs to have extensive critical care interventions and then be transferred on to our local coronary cath lab, a major trauma that can be fully immobilised and have secondary interventions and resuscitation before being transferred on to our tertiary trauma centre, or indeed one of the elite sports players who may have sustained a chest, head or musculoskeletal injury who needs to be assessed here under our auspices and with integrated care of the musculoskeletal and sports medicine specialists that work with them on a daily basis before they're transferred on for further imaging treatment or more diagnostics within the healthcare links that we have at this stadium. So in general, there is a job here for most people who work in healthcare and has transferable both clinical and management skills that we can definitely, and I certainly bring to my day-to-day practice working in emergency healthcare within the NHS.